We're going to begin this hour with new information about the rollout of the coronavirus vaccine. Very encouraging. Millions of doses could reach Americans before Christmas. Now, that's according to a federal document obtained by CBS News. The first shots of Pfizer's vaccine could be ready for patients as soon as December 15th. That's just 2 weeks from today.
Moderna's vaccine would be available starting December 22nd. Both companies are waiting for emergency authorization from the FDA. More than 96,000 people are currently hospitalized with the coronavirus nationwide. In the hard-hit Midwest, the state of Ohio is reporting more than 5,000 current hospitalizations. That is a 200% increase just since November 1st.
And only on CBS This Morning, we are joined now by Ohio Governor Mike DeWine. Governor DeWine, good morning to you. Every state in America right now is finalizing a plan to receive and distribute the very first batch of coronavirus vaccines. What can you tell us about the plan in Ohio? Who's going to get it first, and how are you going to get it to them?
Well, first of all, this is just great news. We had a call yesterday with the Vice President. Dr. Fauci described this as an extraordinary outcome. And so we're very, very happy. It can't come too soon enough. We have over 5,000 people in our hospitals now with COVID. So it's coming. And, you know, we're excited about it. You know, the first responders, our first-line nurses, first-line doctors, those are individuals who clearly need to get it, are people in our nursing homes who are the most vulnerable. So, you know, I think in everybody's first tier, those are the people that are in the first tier.
Secretary Azar yesterday told us that governors are air traffic controllers. In other words, you're going to be telling the federal government which hospital, which pharmacy to send the vaccine. Do you have those hospitals in mind, and do you have the resources there to actually receive the thing, keep it cold, and give it to people?
Yeah, we do. We've already identified the 10 places in Ohio, the hospitals. We're going to identify in the next several days for the federal government all the other places where the shipments are supposed to be made. For the smaller counties, we may actually break those out, and our National Guard may be involved in getting those out as well. So we're moving along, and we're excited. You know, that December 15th date just can't come soon enough. We're very excited about it and very happy about it.
It's absolutely exciting. It's also tricky, and the stakes are high. At one point, Robert Redford, the CDC chief, said that $6 billion would be needed by the states to facilitate this distribution, but only a couple $100 million have been put out there. You have all the money you need to pay the people you need to get these vaccines everywhere in the state?
No, we do not, but we're going to get it out one way or the other. We have the ability to do that. What we would like, of course, is a bill from Congress. You know, you carried a story this morning about negotiations continuing on, and you know, I'm still hopeful that Democrats and Republicans and the president can all get together and get a bill passed, because we really need that. We need to be able to roll the money over, for example, that's already been sent out. We need the flexibility there. Our local governments need some money. Our schools need money. So
help me understand.
Very much like a bill.
If you don't have the money to pay the people to distribute the vaccine, how are you going to do it?
We're going to do it. I mean, we have CARES Act dollars that we can use. We also have, you know, we're going to do whatever we have to do to get it done. But the bigger picture, I think, is that Congress does need to pass another bill for many, many reasons, and I'm hopeful that that will happen.
Governor DeWine,
no one should, Ohio should think that if Congress doesn't pass a bill, we're not going to get this out, though. I will make that very clear. We will get it out, and we'll start the shots just as soon as we get it.
There's a lot of skepticism in some parts of the country about the vaccine, its safety, whether people will be willing to take it. That's a big obstacle. What's your plan in the state of Ohio to convince skeptical populations that this is a good thing?
Well, I think the most important thing is what medical doctors say. And, you know, one of the things that we've tried to do is throughout the pandemic, particularly in the last month or so, is to have frontline nurses and doctors talking directly to the people of the state. I think they're probably more believable than the governor and other politicians. So that's who's going to be talking to the people about this, because you know, as Dr. Fauci pointed out yesterday, you know, everything has been followed, the protocol. It's been quick, but there's no shortcuts that have been taken, and that people will be able to feel confident that they can take these this vaccine. And I think that message, though, comes not from politicians. That message comes from doctors and medical experts who understand what went on in regard to the development of this vaccine. I think those facts are going to come out more in the next several weeks.
I hope people hear him. Governor DeWine, I have to ask you about the impeachment articles filed officially against you yesterday, accusing you of callous disregard for the businesses and the people affected by the restrictions you've passed in an effort to save lives. What's your response to those articles?
Well, look, it's four members of the General Assembly. They introduced a resolution before to have me impeached. I guess they have a right to go and file anything they want to. But, you know, we're going to stay focused on what we have to do. As you pointed out, we're being hit very, very hard.
But Governor, this is not a small issue. It's tied to vaccine acceptance. It's tied to wearing masks. It's tied to whatever the next stage is for you in terms of public health and prevention. These people think you don't care about them, and they're accusing you of disregard. I mean, what's your message to those politicians, but also the people who follow them?
Well, what I said yesterday in our press conference when I got that question was they should talk to the first-line nurses. We had 4 nurses yesterday on our press conference. It was gut-wrenching to listen to them when they described how it is when someone is dying of COVID, how it is when someone cannot be in contact with their family, and tremendous toll on these nurses, on the doctors, on the people on the front line. So people who, you know, want to criticize measures like wearing masks and basic things that we know absolutely no work, you know, they should go talk to those frontline health people, because I think when they listen to them, it's pretty clear we have to do whatever we can to slow this virus down.
You also called it foolishness, I will note. Governor Mike DeWine.
It's ridiculous. Thank you.
Ridiculousness.
Yeah. Thank you. Yeah.
A synonym. Thank you very much. We appreciate it, Governor DeWine.